Welcome, everyone. Today, the end of March 26, and I have a special guest with me today, Dr. Andrew Neville. And we have agreed, we've spent about 7 minutes chatting. We have agreed to contrast and compare our practices and really explore some of the modern paradigms that have kept us locked into a way of looking at things as complex as chronic fatigue and anxiety and depression. And we're just going to shoot the breeze, really, just have a chat about how we see our respective work. Now, briefly, because I know this is going on your channel as well, Andrew.
Mm.
My name's Jenny Lynn, and I have a company, a small company called Open Mind Therapy, and I am on YouTube under Jenny Lynn Open Mind. And I've been working with chronic fatigue as a psycho-hypnotherapist for 25 years. And over those years, I've developed training programs for my colleagues, and I've done a lot of support groups and mentorship groups with the patients or sufferers with chronic fatigue. So I've kind of come at it, and I've also been a Buddhist for 40 odd years, and so I'm coming at it from a more sort of psycho-spiritual perspective, and trying to look at the whole being, which is something Andrew and I want to discuss. Where did the whole being go? Where did it get lost in the sands of time? So, Andrew, I wonder if you can introduce yourself and tell us a little bit about your background, how you got to where you are.
Yeah, sure thing. So I'm Dr. Andrew Neville. I'm a naturopathic doctor here in the U.S. We practice in Pennsylvania, a little about an hour north of Philadelphia here. I came to work with my patients, some of whom have chronic fatigue, ME, fibromyalgia types of diagnoses. Others are really suffering from burnout or just defining things by their symptoms, right? The anxiety, depression, what I tend to lump into this idea of adrenal fatigue. I suppose that's, if you Googled me, that would be my specialty, adrenal fatigue. So I've been doing this for about 24 years here. I came to work here, studied out west in Washington, and then did a residency here under a brilliant pioneer of this work, Dr. Gerald Posnecker, his information was instrumental in me finally understanding some of my problems that I was dealing with, which we can talk about. Did a residency with him and then took over after he passed away. So for about 24 years now, 7,000+ patients, basically one-on-one. We used to have patients come and stay with us. We've got a guest house on our property where people would come and stay from all over the world for a couple weeks or a couple months. That form of treatment is unattainable to many, unfortunately, to get that level of care. So we've developed programs. Most of my patients are distanced now. We have conversations over Zoom, and we can get into all of that as well. I have a YouTube channel, Dr. Andrew Neville, website, drandrewneville.com, and a Facebook group. I've got a private Facebook group, which is great for people specific to kind of curious about how I approach things, which, as I've learned, is actually, you've got another guest, which is somewhat unique, very much holistic, and I'm just really excited to have the conversation. It's brilliant.
Yeah, great. Thank you. I'm intrigued about this guest house. I've always fantasized over, being able to host clients and to get them, really engaged in their whole learning. Is it something you still do?
It isn't. Logistically, it was difficult. The financial component was pretty difficult to put people up and all that added expense. Although I too still daydream about that, one of my long-term goals in the midst of still trying to see patients one-on-one and run programs and eventually not only just teach coaches, which I've done, but teach practitioners to do this work, but is to have a center where people can come and learn, like the old school sanatoriums that they used to have, where people can come and be educated and have truly interdisciplinary, right? Learn about the right way to eat and how to cook and how to be with nature and have therapists and other specialists here as well.
Amazing.
It's a it's missing, right? It's missing because I know here in the States, chronic, certainly when you get to the point of chronic fatigue and ME, it can be incredibly debilitating, right? And there's no place for a lot of these patients to go. And unfortunately, they end up in the mental hospitals here, right? Like hospitalized amongst, some they just don't fit, right? They don't
Yeah.
fit and they need care, and our system's just not set up to do that. So
Yeah.
at some point, yes, that's the
Yeah,
goal.
yeah, yeah. Because they do tend to fall between the cracks, don't they? Because
Oh
I
yeah,
often look at it as sort of like, good old Descartes when he separated the mind from the body and said, "Oh, we don't want that nonsense, that psychological, spiritual stuff getting in the way. Let's just look at the material." And at that moment, I think we caused a problem, you know,
indeed,
because we just stripped out what made us truly human from the body. Um,
true,
and
true.
I think we've been suffering with that malaise ever since, and it's been growing. It's accelerated with mass media and everything. Everyone, as we were saying just before the call, everyone is tuned into wanting a magic pill for a magic solution. Something. There must be something, and
Right.
I think also mass media and the division of the mind from the body has alienated us from ourselves. It's put more trust in things outside of us than
Indeed.
within. What
Indeed.
what would you say?
Yeah, no, I would agree. And it's, part of that has robbed us of our power, right? Our autonomy. What we do, and certainly I imagine you find this as well, in order to fix this, part of what we have to do, and I see when I have a patient in front of me, my coaches and I are trying to figure out what their therapeutic puzzle looks like with relation to this problem. And this problem we can get into and we can define that a little better. I call it adrenal fatigue. Really what it is ultimately is this broken stress response system, no matter how it got broken. Um, that puzzle is large, right? And certainly one of those pieces is for us to do our own work, right? And figure out to what degree have we contributed for whatever reason, right? Whether it's trauma or abuse or micro trauma or bad subconscious programming in childhood that created weird dysfunctional behaviors and habits and personality traits and things like that we ended up getting kind of locked into, that's kind of defined how we live and how we think and how we feel and how our mindset and all those various things. To me, separating out the mind, the body, the spirit just doesn't make sense. We are holistic beings and we need to be treated as such. And that's something different for me. My practice has evolved over the years. I always want to know why. Forever, there's this drive in me to know the answer, right, and to find out why things are going on. When I was suffering from things, which goes back to childhood for me, things started to get worse when I was in undergraduate school, laid out for months on end at times, and dealing with anxiety and gut problems and immune system problems, all these various things. And like many of my patients, and I'm sure many of your clients, we start to go to the various doctors and the specialists, what I've lovingly coined the specialist merry-go-round, right? And again, they're all, it's this reductionist thinking again. The cardiologist says my blood pressure is going up. At 25 years old, my blood pressure is up because it's genetics. Your father has high blood pressure, right?
Mm.
Well, it's another conversation we should talk about, right? That
Yeah, yeah,
genetics versus epigenetics, because
yeah.
lo and behold, once I figured out what was going on and dealt with it, all of a sudden my high blood pressure went away, and I'm pretty sure I didn't change my genes, right? It, so you go to all these various specialists, and they're all looking really powerfully at each individual piece of this, and they're good at it, right?
Yeah,
Like the
yeah.
the old parable of the three blind men standing around the elephant, right? One at the tail, one at the trunk, one at the ear, and they're describing what they see in see what they experience in exquisite detail, but nobody can unblind them and look at this as a whole, because truly
Mm.
this is the elephant in the room in my experience. this dysfunctional stress response system. Again, no matter how we've gotten to that space, it's profoundly affecting our well-being, our body, our mind, our spirit. And one of the harder things for people to grasp, I find, is that it can indeed get severe enough where our metabolic thresholds start to change and we can become debilitated, severe enough to be diagnosed with chronic fatigue, ME, fibromyalgia, those kinds of things. I think it's hard for a lot of patients to believe that, stress can actually cause this. However, if you talk to any of the PhDs that research stress, like they'll be like, yeah, of course, it's obvious, right?
It's
Yeah.
mad, isn't it? I mean, we've been splintered in all these specialities,
Hmm.
and everyone puts their faith in each speciality. But when do they ever come together and actually look at the whole person? Almost never. You
Exactly.
mentioned high blood pressure there, and I
Mhm.
remember reading a book by Samuel Mann, Dr. Samuel Mann. I don't know if you know
Okay.
him.
No.
It was The Hidden Causes of High Blood Pressure.
Okay.
And he explored, without realizing he was doing it, he was just asking questions, what's going on in your life at the moment, to his patients.
Mm.
And occasionally he would hit on a nerve in somebody and they'd burst into tears. And their pre-bursting into tears blood pressure was high, and their
Mhm.
post-bursting into tears was low. And
Interesting.
he's going, "Whoa, what's going on? This isn't just blood pressure. There's something going
Right.
on." And so he concluded that, it was stress within the body. I mean, he's got another way of putting it,
Hmm.
that was just elevating the blood pressure. And if you think about it, if you're in a fight flight mode, if you're surviving and holding everything tight together, you're going to
Hmm.
be constricted. It makes perfect sense, doesn't it?
It absolutely does.
And the minute you release that constriction, you're going to sort of experience a
Hmm.
release in the body.
Indeed. Indeed.
Um,
I'm a, I try to go kind of zoom in and out as often as possible. I want to look at this 30,000 foot view, but then get into this even a microscopic view and in this effort to understand why. And in a simplistic way, I talk about it in terms of this balance, right, between being in fight or flight and being in rest and digest. And in the normal course of action or our day without this dysfunction, let's say, we get up in the morning and we have responsibilities and tasks and to-dos and things like that. And so we're a little sympathetic dominant, right? Put ourselves in fight or flight a little bit, which is good and healthy, but we do cause a little wear and tear on our body when that happens. And then we go to sleep, so we're up for 16 hours doing that work, and then we go to sleep. We turn on the parasympathetics, that rest and digest side where we heal and repair, and somehow that 8 hours is enough to compensate for the 16 hours of damage. We wake up the next day and we live to do it again.
mm,
When, again, for whatever reason, we start to get stuck in fight or flight too much, it's incredibly predictable. And these are recognizable patterns. That excess wear and tear causes problems. Specifically, we could talk about cortisol and adrenaline, right? Our major stress hormones. We know what they do. They're
yeah.
life-saving and amazing when we use them once in a while, but they're also vasoconstrictors, right? So they're going to cause vasoconstriction. They also mobilize energy too much. So, and if you have too much energy, too much sugar in the blood, well, that's going to lead to problems over time, right?
Mm.
Even doctors now know that cardiovascular disease and metabolic syndrome, prediabetes, diabetes, these are stress related disorders, but, but they don't know how to fix that stress component. So so just take this for your high blood pressure, take this for your sugars, it's this, again, this kind of simple model of just, putting patches over this deeper underlying problem.
I think as well, there is a bit of a financial, well, a big bit of a financial imperative as well. If I can prescribe a drug, like your eye roll, very good. If I can prescribe a drug, then I've earned my money and I don't really need to think about it. And since everyone does it, it's the norm, it's okay. I'll just follow the masses. Whereas anyone like what inspired me just a moment ago was when you said you always wanted to know why. It's not good enough to just say, here, take this pill. It's
Mm-hmm.
not good enough, especially, and in particular in your case, where you experience in your 20s this kind of, immune system, nervous system compromise where suddenly things don't feel right. You have to know why. Taking a tablet isn't good enough.
Yeah,
And I think our personal experience of our own background and our desires to know why shapes our practice. It has done with me.
indeed.
And if I may share briefly, when I was 23, I was at university doing a languages degree.
Mm-hmm.
Um, and at the end of my degree, I got schizophrenia.
Mm.
How did that happen? How did that happen? Well, extreme stress, extreme insomnia.
Mm-hmm.
There's been experiments where you deprive people of sleep and they become schizophrenic or psychotic in some way or another. So
Mm-hmm.
that happened to me. Um, and I
Mm.
was chronically insomniac, but I came out of it. I don't even know how I came out of it, but I just stopped taking
Mm.
the drugs. Once I'd calmed down, the drugs did serve a purpose, but
Mm-hmm.
once I come to calm down, that independent kind of curiosity and why kicked in. Yeah.
Mm. Good for you.
Because
Yeah.
I'm not prepared to just accept other people's judgments about what's going on in me. I'm not prepared to do that. You work with me, not you don't elevate yourself and tell me what
Indeed.
to do. Yeah. And I think that has informed the way I work with my clients now. That episode with schizophrenia was like 40 years ago. And I've never had a relapse. So, I mean, I came out of it and that was that. So I was very fortunate. But, in my 30s, training to do this work, I'm still why? What's going on? Why, why,
Mm-hmm.
why, why?
Mm-hmm.
And I
Mm-hmm.
think that is such a quality. I don't know if you agree, such a quality that you should look for in your doctor, therapist, or whatever. What would you say?
Yeah, I would agree. 100%. 100%. I mean, unfortunately, I think professionals aren't really trained, right,
Yeah.
to dig as deep as they could and maybe should. I think that functional medicine here in the States and integrative doctors, I think they do it a little better. Certainly, they'll run, different tests. It's doctors are they're stuck in a really tricky paradigm. They're trained a certain way. They're trained to, prescribe these medications. I mean, this is what it is. We're trained to, look at the blood work, and unfortunately, for most of my patients, all that blood work tends to come back normal, which is a frustrating, of course, situation for everybody. And then they end up going usually to alternative medicine or functional integrative doctors, sometimes naturopaths, and I find that they tend to be nicer about things, and they tend to be a little more holistic. They'll even accept that this adrenal fatigue thing is actually a problem. But I've discovered that when they find it, they just grabbed hold of a tail of something that's way bigger than they anticipated. And it's very easy for doctors to divert to chasing after the symptoms, right, of fight or flight, right? And okay, you have anxiety. It's this one drug for one disease paradigm that we talked about earlier.
Yeah.
You have this, you take an anti this. You have that, you take an anti that. Well, that might work for infectious disease, but for anxiety, for depression, for insomnia, for weight, I mean, if you're lucky enough to find the right drug, you might cover up that symptom, but you haven't fixed the underlying problem, and that wear and tear perpetuates over time. So I consider it like basically like putting a piece of tape over the check engine light in your car. You don't see it, you don't see the signal, but the problem hasn't gone away, and the damage is going to perpetuate over time, unfortunately.
Yeah.
We do this symptom chasing a lot of times, both conventional and alternative medicine. And to confound the symptoms that come from being in fight or flight, right? And there's a big list. When we're in fight or flight, we're also shutting down a good chunk of our physiology that's non-essential, right? Because if there's a tiger, the proverbial tiger's in front of you, what do you need? Like you need your heart cranking, you need your lungs pushing out oxygen, and you need a lot of sugar because you need fuel to fight. But your immune system, don't waste energy fighting some infection, right? There's a tiger in front of you. Your digestion, not a good time to sit down for a meal, right? You'll be a goner, right? We've got this tiger. Same thing with reproductive hormones, right? You're not going to stop and procreate right now, right? The body doesn't care about your menstrual cycle or whatever. So we shut all this stuff down.
Mm.
And then those systems, again, if you do that once in a while, that's life-saving. That's a good thing. Conserve that energy, deal with the threat, but you've got to shift back. If you don't shift back, and this is one of the key problems is that the body starts to get stuck in fight or flight. So we can talk about that. But if you don't shift back, now you've got immune system problems. Maybe you get sick a little more often. You have recurrent viruses. My Epstein-Barr used to reactivate all the time. And we used to treat it all the time until I realized everybody has Epstein-Barr. Why does mine reactivate? Why?
Interesting.
Right?
Yeah.
But why? Why does mine reactivate and somebody else's doesn't? The problem is me, right? So then all right, my immune system must be off. But why? Right? I ask one more why. So why is the immune system off? Well, the biggest control over our immune system itself is that stress physiology. Predictable shifts will develop allergies and inflammatory conditions. The gut shuts down. So all my patients have this IBS diagnosis, right? And whether it's heartburn or dysbiosis or SIBO now, we give all these fancy names to these things. And menstrual cycles are down, libido's down, messes with menopause, thyroid gets shut down.
Mm.
So a lot of doctors, again, better doctors, I find, will look at those systems and those issues and try to treat those. But I find those to be secondary types of conditions. And it's hard to fix those problems when the body is purposely suppressing them. To me, it's like we're trying to push a car forward, but
Yeah.
the parking brake's still engaged. Like I try to encourage all my patients, let's release the brake on this thing, right? And as we shift this physiology over time, the symptoms that come from stress physiology, they start to decrease in intensity, frequency, and duration. And then we turn on this rest and digest physiology, stop suppressing those systems, which are also the systems that we use for healing and repair. And then the
Mm.
body can heal itself.
Yeah.
The most beautiful thing that I find I can do with patients is encourage them and encourage their physiology to shift in a way that they heal. The body knows how to heal. Our bodies have been healing for thousands of years, right? Without all this modern medicine stuff. But they're not going to do that efficiently if we're stuck in fight or flight. We have to turn on that physiology a little more strongly, of course.
Yeah, totally hear you. And I'm wondering, I mean, what, I don't know if in my client base there's any kind of typical recovery.
Mm.
But I suppose I could argue that once I get people to come out of that urgency of what will happen if, and oh, if I haven't, I haven't got my defenses in place, somebody's going to get me, I don't know how to defend myself, that kind of thing, underlying, not conscious necessarily.
Sure.
But sometimes you get clients get even more tired. And I say, fantastic, let yourself relax. Yeah.
I love it. I love
You've
it.
been holding so much tension in your body for such a long time. Let your body relax. Yeah.
Yeah, yeah, indeed. I laugh because that's exactly the experience that we've had when again when we had our guest house here. People would come in and eventually, like a week, 2 weeks in, they're like, "Doc, I'm even more tired than I was before." But they were wired and tired, right? That's this conundrum with this condition, right? I'm exhausted, but I can't sleep. I'm exhausted, but I'm hypervigilant. What I've discovered in doing this with so many people is that we've got to deal with that wired part first. We've got to calm that system down first. And that can, when you're wired, you're running on adrenaline and adrenaline causes damage. It's life-saving when you need it, but it causes damage. But it also gives us energy, right? So it feels a little better, but we have to cut that off in order to be able to heal from the bottom up. I describe it as it's like we're trying to fix the engine of your car, but if you're still wired, you're still driving that thing down the road.
Yeah.
Whole lot more effective if we can pull that off the road and stick it in the garage and actually get some work done, allow our physiology to be able to heal that.
Yeah.
Yeah, so it makes perfect sense. And people would say that, and Dr. Posnecker, my predecessor here, he would laugh and he would say the same thing. That's fantastic. And they're like, what?
Yeah, yeah, yeah. It is
Brilliant.
because if especially if my clients, your patients, but if they're expecting just to drift into, you know, happy wellness, it's not going to happen. There will be ups and downs as you get
Absolutely.
well, because not only are you resetting your physical nervous system, but you're resetting your mind, you're resetting your expectations and your understanding of yourself.
Everything.
And, giving yourself permission to relax when like when you've let go of a hell of a lot of stress and wiredness in the body
Hmm.
is such a therapeutic thing to do because the body gets an opportunity at last to rest and digest.
Indeed, indeed, it's a little scary for patients because I describe to them like, well, you're now feeling kind of the true nature of your dysfunction right now, how debilitated it is. I mean, if we think about it simplistically, it's like you're a zebra in the wild running from a lion perpetually, right? Perpetually. I mean, that zebra is going to be dog tired. I mean, there's a tremendous amount of damage. I think
Mm.
about it in terms of mitochondrial dysfunction because of the wear and tear causes the mitochondria, the little energy producers in all the cells, right? They lose their ability to turn food into this universal form of energy. So the functional capacity that I use, it just starts to reset, right? And it resets lower and lower and lower. I think I saw you describe it as a reduced threshold, right? For capacity, so, people who were once, 90, 80% functioning, start to lose that functional capacity and we start to, our life gets smaller and then that becomes a stress and we don't understand why. And that becomes a stress. The doctors don't understand why. And it does get confusing, frightening, and that feeds the stress physiology, of course, right? So you do
You
have,
get into a kind of a loop, don't
oh,
you? It
it's
goes round and
terrible.
round.
Yeah,
Yeah.
it's terrible, right? It's terrible. And I think, I'm always looking for, as I work through patients, and you were asking about trajectory of healing, and I have a couple programs that I use. One's a 2-month program, one's a 6-month program. And I'm like, look, you're not going to be fixed in 2 months. You're not going to be fixed in 6 months, right? You'll be shifting and you'll be noticing differences, but it takes some time. Let's think about expectations, right? How long has your body been stuck in fight or flight? And they're like, well, ever since COVID, right? Or ever since the divorce, or ever since the car accident, ever since that bad, um, uh, whatever, you name it, right? That bad infection. Ever since then, I'm like, all right, well, but let's think about before then. How long have you been dealing with depression? What about anxiety? What about your sleep? What about your energy? What about those gut problems? How long has that been going on? And helping patients to understand and develop awareness around the fact that, okay, this condition's probably been going on for many more years than I really thought, oftentimes decades, oftentimes our entire lives, we've been dealing with this. And what I find is that helps people understand, okay, that's why, one drug isn't going to fix all this stuff. That's why it's not going to turn around completely. It eventually turns around completely, right? But it won't turn around completely in just a couple of months. I think that helps to manage some of those expectations, right? That perception and paradigm, I think, help
Yeah.
manage those
It
expectations.
must be quite refreshing for them to meet a doctor who can look at the whole picture, um, because and to be able to show them, lay it out. This is what your history has been like. The people that come to see me, generally, there are some people that aren't like this at all. Generally, they've done all that. They've looked at their history. They've done everything they could possibly do, or so they think.
Hmm.
And they've done the programs online, and they've done this therapy and that therapy. They've
Yep.
done detoxing, deficiencies. They've done everything, and they're still not well. And
Yeah.
uh, and they may even be aware of the trauma from their childhood. I mean, they may be aware of everything. But
Hmm.
what I'm finding with some of my clients is that they're still not really at home. There's still a part of them that's worrying
Hmm.
about what other people think, that's worrying about what might happen next. And it's so elusive they can't quite grasp it. They think they've done
Mhm.
everything. And there's this kind of race to get well. There's this kind of panic. I've got to get well like
Mhm.
tomorrow because I can't afford to waste any more time doing this, which is all part of what I understand to be the psycho-spiritual part of the condition. Certainly with
Mhm.
ME, I know you work with other conditions, but
Yeah, sure.
that kind of obsessive, I'm running, I've got to, I can't stand still because I'm running to where I need to be to stay safe.
Indeed.
So, for me, what was I about to say? I quickly jotted it down. Yeah, this expectations of how quickly to get well. I really like what you're doing with kind of mapping it all out for people so that they can see the various elements of what's involved in their recovery. I'm finding that I've seen about 300 clients in the last 2 years since Raylan's video, which has like blown me away, really. But um,
Mm.
I'm finding that probably 40 or 50 of those clients have come in and they're just ready.
Yeah.
They're just ready to go. Like
Hmm.
literally 1 or 2 sessions and they're off.
It's amazing. Hmm.
And it's like, whoa,
Yeah.
whoa. And essentially what's happened is they've taken control. They've come home within. They realize that it's up to them and they can't be outsourcing everything anymore. And all
Brilliant.
I've really done is held up the mirror and said, look how amazing you are. You know, look how amazing you are. You're already perfect. And all we need to do is teach you how to love yourself. And, I know that that's on the spiritual side because that's how I work. But I'm
Yeah, sure.
wondering, tell me a few stories of have you had those sharp, incredibly fast healings or how?
Yeah. Yeah, yeah. No, it's there's so much there that I wanted to address. It's brilliant. That work that you're doing is incredible. It's a huge piece. To me, simplistically, I think about this therapeutic puzzle and they've got a bunch of these other pieces in. They know things and all that, but there was this missing piece of the puzzle, right? Put that piece of the puzzle in, the body shifts, and they can make dramatic improvements. You had mentioned in the beginning that people would be refreshed to hear somebody explaining all these various things, and I think some of them are. A lot of my patients will come to me through my YouTube channel, and they've really dug in, right? They've just kind of devoured that channel. Things start making sense. You're describing me and my situation, everything that I've been through, the ups and downs, the whole thing, and then some who want more specific guidance will reach out to me, and they're ready. Others, which I'm sure you experience as well,
Absolutely, yes.
perhaps not so ready. And then it's this evolution, right? This peeling of the onion. I find that patients with who go through this self-discovery process of what this is all about and all the intricate pieces, right? As we have our numerous conversations, as we do, that self-discovery is important. Okay, yeah, so I do have this negative mindset constantly, and oftentimes they don't get to that realization until things maybe settle down a little bit. Maybe if we've done some other things to shift their physiology a little bit, work on vagus nerve things, or get them to do a relaxation exercise consistently, whatever it may be, supplements and things. But to me, supplements are very, very secondary to all of this. When I approach patients, there's this naturopathic hierarchy of therapeutics. If you can picture a pyramid, and at the base of that pyramid is going to be lifestyle, and then diet, and then what I call balance. And then we start going up, and we start getting into maybe supplementation. Maybe it's general support, system support, maybe targeting symptoms or maybe hormones, and at the very top would be drugs and surgery. And I'll work on all these levels of this pyramid. I'm not against any of them, even drugs and surgery. These things have their place. They're necessary sometimes. But the majority of my work is at the base. And I find that the more work we do at the base, the longer lasting the effects, the greater the change, the less cost, the less risk of adverse reaction as opposed to working at the top. But working on that lifestyle component, and think about lifestyle, right? That's everything, right? Of course, it's your mindset, it's your subconscious programming, it's how you sleep, it's your relationships. That requires us taking responsibility, right? That's the hard part, right? The base of that pyramid is taking personal ownership and responsibility for how we run our lives. And a lot of times we're just spinning based on, childhood stuff and societal demands, and there's no time to, stop and think and kind of process these things, right? So I think about them being refreshed. Some maybe when we talk about all of it,
Yeah.
but some go kicking and screaming,
Yeah.
and that's okay too. I'll work with anybody to try to help them understand how I see this and put it all into
Yeah.
perspective in that way.
I have, I'm surprised actually, I still have these people coming through because my work is, not so in this physical realm, it's more in the psycho-spiritual. But
Right.
I'm surprised that people still do come to me, very few, but they do come to me and expect me just to fix the CFS. Yeah.
Yep.
And
Yep.
they're going to go through their divorce crisis and their, whatever else it is, but that's got nothing to do with their chronic fatigue. And I'm I'm getting a little bit braver nowadays about saying, I don't think I can help you
Hmm.
unless we work on, the relational issue that you've got on with your husband or your wife or whatever. Do you know what I
Hmm.
mean? Or
Absolutely.
because that is a demand on the fight flight. That is fight flight. If you're going through something in a deeply personal way in your life and you've got chronic fatigue,
Hmm.
then you know what can you expect from anyone if you're not prepared to do something about the issue? Now,
Indeed.
then you can find that that person may be completely disabled in that relationship because it's tapping into childhood trauma and stuff, and it's
Hmm.
being perpetuated in that situation. But
Hmm.
they want to fix the ME chronic fatigue, but they don't want to look
You,
at what's creating it. Is
you
that
got it.
is that kind of where you?
Oh, 100%. I mean, I see that all the time. That kind of work is it's so crucial, right? And it
Yeah,
is certainly a missing link. I'm always, I mean, well, you've spent plenty of time around therapists, and just like mechanics or naturopathic doctors, there's kind of good ones and then there's better ones, right? And I love therapists that have this more holistic view as opposed to the fact that, okay, this is, I don't know, purely psychology. Let's dig into trauma. Let's look at this in a more holistic way. And certainly understanding trauma and abuse and all that is important, but it is, it's broader than that. So that it's an incredibly important piece of the puzzle, your work, and I love. I hope you stay in practice so I can be able to refer patients to you, especially because you do things over Zoom like I do,
yeah, I do.
which is amazing because I've got patients all over the world. I think probably like you do. Um,
Yeah,
it's such an important it's an important piece, and by the time patients end up coming to me, they've tried everything, right? And one of the most common things I'll hear on day one is because I'll always ask, like, all right, what made you finally reach out? Well, I've tried everything else, or I'm desperate, right? Desperation is one of the key hallmarks that people will talk about. And I have this privilege of receiving these patients. They've been tested out the wazoo, right? Scoped up and down and all the numbers and all the various things. They've tried to treat all these secondary dysfunctions, and maybe they got a little better. Like you said, they did the detoxes and the candida cleanses and treated the chronic Lyme or the mold or whatever it might be, yet they're still dysfunctional, right? And then most of them are ready, right, to deal with this at a bit of a deeper level, as it starts to make sense. I had one patient. It's funny because all these patients come to mind, right? One woman I was just talking to yesterday. She's a nurse, and I'm trying to manage her expectations, right? She's got all the typical symptoms, but she's had anxiety from a very young age. Depression and medicated and now weight gain, and she wants to, and she's pushing herself, right? She's got this perfectionist attitude, which only came out later on in the conversation. when I told her, okay, you have these couple classes in nursing school. I don't want you to no A's, no A's. And she just laughed. She's like, I get A pluses. I'm like, I've been known to yell at my students. I don't want to see any A's on your report card, right? Because that perfectionism, right? And again, that needs to be dealt with. I think this is perhaps the first time we've had that conversation about that because that's going to continue to fill up. I consider it a bucket. We have this bucket of tolerance for stress. And people who develop this condition, we have a tendency just to be better at filling up the bucket than the average person, right? We tend to care about things, about society, and we're doers, right? And we care about what we do. So we do things well. And then people pat us on the back and that feels good. And we do more things well and we do too many things well. And now we become perfectionist and overachieving and type A. Like there's all kinds of reasons why we fill up the bucket. And that's not to say we ask for everything in our bucket. That's not all, we didn't ask for the trauma, the abuse, the head injuries, the accidents and things like that. But we have to address what we are responsible for, right? And part of that process is brilliant is when what you do is address at one of the deepest levels possible that mindset. Where does that behavior come from? Why can't you put yourself above, right? It's, oh, this is selfish if I take care of myself, right? Or if I put myself first. We get all
Yeah.
these
Yeah.
crazy bad messages from an early age.
Absolutely. Yeah.
One of the things I talk about quite a bit is this concept of sensitization, central sensitization, right? Central for the central nervous system. What happens with stress physiology is that those stress hormones, again, life-saving in the short term, but what they do is they sensitize the nerves and they sensitize all the nerves. And most of the research on central sensitization is on pain. But it also happens in the limbic system, right? Which is, controlling the show, right? The amygdala, of course. That limbic system gets sensitized and now becomes trigger happy. And that limbic system has the job of interpreting our environment, right? Internal signals, signals from the external world. Is this stimulus harmful, dangerous? Can this thing kill me? Do I got to jump this body into fight or flight? Throw out some hormones, sympathetic nervous system. Okay, let me deal with that threat. Well, now minor stressors don't generate a minor response, right? Patients start developing, we make mountains out of molehills, minor stress, major response. And we can even look, right, with functional MRIs, look at somebody's brain, and you can see the amygdala lighting up more so than it should, right? Meaning that pathway, right, towards stimulus stress response is much stronger, right? They say that nerves that fire together, wire together, that pathway is much stronger. So you can even see that in the sensory nerves. You've probably seen this. It's pretty wild. A lot of my patients are, sensitive to these bright lights, sensitive to loud sounds, sensitive to smells, even sensitive to touch. You could touch one of my patients and the brain registers pain, right? We're on hypervigilant, red alert. Now we're over perceiving our environment as dangerous, and there's just a lot of stimuli, which just
Wow.
keeps us stuck in fight or flight from a physiologic perspective, a psychoneuroimmunologic perspective. So one of the things, we always work on is how do we decrease that sensitization that has happened over time, and we want to hit it from every angle we can. Certainly the work that you do, but even again, even just strengthening this opposite muscle, this parasympathetic muscle, with working on vagus nerve exercises or somatic exercises or doing the relaxation exercise, meditation practice. Some kind of relaxation exercise is kind of imperative in this, and there's even some supplements that can target this neuroplasticity, right? I just described neuroplasticity in the wrong direction. Well, if it can change that way, it can change in a favorable way as well. How can we augment that process? So hitting
What
that from,
supplements would that be then, Andrew? What supplements are they?
yeah, I mean, at a basic level, omega 3s,
Okay.
omega 3s, right? All of our cells have this lipid bilayer, if we go back to cellular biology that we never wanted to remember again. And the more omega-3s that we have in those cells, the better those cells function, the more efficient they are. Which is why there's research when you optimize omega-3 levels on helping with cardiovascular disease, on helping with diabetes and metabolic syndrome. It helps with the mitochondria, which has this same lipid bilayer. There's research on omega-3s and helping anxiety and helping depression and helping insomnia. So even just optimizing omega-3s, but there are some others. There are some plant extracts that are useful along these lines. Resveratrol is one of them. Resveratrol helps with both the neuroplasticity as well as mitochondrial repair and encouraging the cells to. It helps to turn on the cell's own survival mechanisms, which is a pretty neat thing because the cells are not they're not doing all the healing and the maintenance and the repair process. When we're in fight or flight, I picture the cells because the whole body is involved in this fight or flight, right? Body, mind, spirit, all of it at a cellular level. And again, I'm more of a physiologic kind of at a cellular level.
Go for it.
I picture this. I picture this cell like I have this image that always comes to my mind of like a World War II manufacturing plant making tanks and bombs and all kinds of things. And it's mayhem. It's going 24/7. There's debris everywhere. Nobody's taking the garbage out. It's a mess in that cell. When we shift the physiology out of fight or flight and we can turn on the chemical messages that come from the parasympathetic nervous system, right? That rest and digest. Now the cells receive the signal. This will go back to like Bruce Lipton's stuff that we didn't talk about yet, but now the cells receive the signal of, okay, it's cleanup time. It's not wartime anymore. Now we can do some maintenance. Now we can do some healing. Now we can do some repair. And we want to hit that from again every angle we can, whether it's omega-3s, resveratrol, berberine does this to a degree. Curcumin has some research that shows that it does this as well. So they all have their place. I'm cautious with supplements because that's what people want, right? It fits into our paradigm, right? Our subconscious program, one drug for one disease. Okay, doc, I didn't want to take that Prozac stuff. What do you have to fix my depression? Can I take 5-HTP or St. John's? Or I'm like, it's not how it works. It's not how it works.
No,
Yeah.
it's a support, isn't it? But it's not the
Yeah,
answer.
exactly.
I didn't know that about omega-3s. I know that our balance between sixes and threes is massively out because of all the plastic food that they're producing. And
Indeed.
and that, we should have I think, is it 3-to-1 or something? 3-6 to what's the
Yeah,
rate?
it depends. Most people say it should be right 2-to-1, omega-6 to omega-3, or some research even suggests 1-to-1. Whereas we look in society in general, it's more like 16 to 20 omega-6s to one omega-3. So, and there's a simple test for this, which is brilliant, called an omega-3 index. The lab that does this that I like, there's other labs, but Omega Quant, this guy, Bill Walsh, tremendous, 40 years of research. This is all he researches, omega-3s, and where you can do a simple blood stick and it detects by percentage how many omega-3s do you have in your cells, red blood cells, which is indicative of the rest of the body. Most Americans at least come in at like 3, 4, 5%, whereas optimal, based on all their research, is 8 to 12%. And when you optimize, either through the diet or through supplementation, when you optimize the omega-3s, it actually reduces the risk of morbidity and mortality across the board, no matter
Wow.
what condition you test it for. It could be dementia, Alzheimer's, again, cardiovascular disease, anxiety, depression. The research is,
Wow.
is incredibly powerful. Yeah. Yeah, that's
I,
one of the hallmarks of.
I was going to ask which one is more bioavailable. Is it a supplementation or is it the food? How would you advise
Well, you
getting
know,
an
the
omega-3?
the naturopathic doctor in me wants us all to get everything from food as much as we can. Now, it's hard, right? Especially these days, unless you're growing your own food, which I love that
I do.
I saw in your bio that you're doing. It's incredible. I think
I
we've
do.
we've we've lost this idea of either self-sustained, taking care of ourselves, growing our own food, or at least going to local farms as opposed to big ag. And then we talked about money. You get money involved in this, and it's a bit of a mess. So it's hard. We're farming nutritionally depleted soils and all that. So the best fish are the cold water fish like salmon, mackerel, sardines. I'm a huge fan of sardines. Anybody that's seen my YouTube channel sees me talk about sardines, like 1,500 milligrams of omega-3s in a can of sardines. But yeah, you can use supplementation,
Mm.
whether it's cod liver oil or some kind of a pure
Yeah.
fish oil from a reputable company. Yeah.
Yeah, yeah.
Yeah.
Because you talked about that, we were talking about how many sensitizing the nerves become really sensitized
Yes.
because of the revved up fight flight response and everything, and then
Mhm.
everything seems to affect somebody.
Yeah.
Um, and going back to that point, it reminded me of I don't know if you've come across Hans Selye from the 1920s with his,
Oh yeah.
the general
Oh, yeah.
adaptation syndrome.
Pioneer, right? He's a pioneer. Yeah.
Yeah, an absolute pioneer, and not really given much airtime nowadays. I don't think he's quite as popular as he should have, been.
Yeah.
And I think certainly as my specialty is ME chronic fatigue, what I'm finding is that is exactly what's happening with the general adaptation syndrome. You're going into a natural alarm response, and then you're trying to regulate and bring it back to normal. And if you can't, you go into exhaustion phase.
Hmm.
And what I've often found with people with chronic fatigue, because they're so disconnected from the fight flight mode, what's going on in their bodies, they
Mm.
still don't understand why they've gone into overdrive. Yeah.
Hmm. Hmm.
It's like, no, I've got to whip the horse while it's down. Do you know what I mean? I just got to
Indeed.
keep going,
Push through it, right? Yeah.
just
Yeah.
push through it. And that attitude tends to be what breaks the camel's back, which sensitizes the body to extreme and
Yeah.
causes that global collapse.
Agreed.
Um,
Agreed.
yeah,
Agreed. So talking in terms of stress physiology is so difficult. I imagine you've kind of run into this a little bit. Whenever we use the word stress, I use the word stress. I can see patients are rolling their eyes back, right? Because stress has suffered this malady that I refer to as semantic saturation, right? The word has been used and misused and overused and poorly defined for so long. It's like everybody has stress, right? Or somebody with CFS-ME who's crashed out like couch bound, and you're going to tell me that stress is causing this debilitating condition? And the answer is yes, but it's the definition of stress. And to me, so you mentioned Selye's work, which is brilliant. Um, this general adaptation syndrome or this system, your stress physiology, is our body's ability to adapt to our environment. And the thing is, we use it all day, every day. Like we're using our stress physiology right now because we're sitting up and gravity is trying to push the blood out of our brain into our shoes, right? That's why a lot of my patients get lightheaded if they stand up too quick because that doesn't work very well. So we have to use those stress hormones, they're vasoconstrictors. Let's keep, blood in the brain so you can have a conversation. The blood sugar drops, right? Your blood sugar drops, and now it's the job of your adrenals to release cortisol, release a stored form of sugar so you don't slip into a coma. So to me, stress is anything that forces and puts pressure on this adaptation system. So we're always trying to reduce those levels. If I look at the bucket, let's scoop out what's controllable. Not all stresses we can control, but some we do. Some we don't think we can control, but we can. So let's scoop out what we can. Let's just create a little space in this bucket. And as we create that space, now there's tolerance to whatever stimuli, and that's what can start to loosen this physiology up. And it's not easy to do, right? Because we're better at survival mode, right? Fight or flight as humans. This is why we're still here on Earth, right? We're better at this than we are at the siesta vacation mode, right?
yeah,
Um, and going back to that sensitization, anybody who has filled up their bucket for whatever reason now is sensitized, so they're even better at doing it. The visual I always have is that this fulcrum that governs this balance, it's spring loaded towards fight or flight.
Mm,
It's been there so long, it's rusted. So
mm.
we got to lubricate the daylights out of this fulcrum to get it to start to shift. And it is incremental. Although you were asking about patients, I had a patient this year, 33 years of a chronic fatigue diagnosis. And as you could imagine, over 33 years, she's tried everything and really had just resigned herself to the fact that this is the way it's going to be. I'm functioning like this. My first conversation with her was in a dark room. She was horizontal on the couch because even sitting up for too long makes her wobbly, and 20% functional capacity. I asked this conversation. So 20% functional capacity, she needed help. Within 6 months, she was above 70%.
Wow.
And the transformation was amazing, just putting the pieces of the puzzle together and helping her to incrementally, kind of get to that place. And, her biggest stress after 6 months was grieving the loss of 33 years of life, right? And not knowing, not understanding that there were answers, right? And there were different ways of thinking about things. And I just try to ask people, especially with those more severe diagnoses, any chronic illness, try to have as open a mind as you possibly can that there might be other reasons, there might be other answers.
Yeah.
Now, she's not out of the woods. I just talked to her yesterday or the day before, and she's in a bit of a dip, right? You were mentioning there's all these ups and downs, right? And
Yeah.
and there is, and she's in a dip because she was babysitting her grandkids. She was taking care of their pets. There was, I don't know, some other thing that she was engaged in. And she had started running. She had started running where, within 6 months, she called it old lady running. So she's like, it's really jogging. But
Bless.
she was running every day and doing these things.
Yeah.
And what she had done was just she had pushed the level of her functional capacity. So even though she's at 70, 80%,
Yeah.
we can still overshoot the mark. I mean,
Yeah.
you could be at
Absolutely.
100%, and if your subconscious programming doesn't allow you to slow down and back off and not be a perfectionist, and not, you
Yeah.
can overshoot the mark and you can experience some of those symptoms. But
Absolutely. That is so familiar to me, that pattern. I see it over and again.
yeah,
There was a couple of things I wanted to talk about. One was,
sure.
I'll dwell on this now. Years ago in the UK, and I think probably still, the only official solution for chronic fatigue was graded exercise and CBT.
Yep.
And the surveys that came back from people that had been through that program showed that the massive majority
Yep.
were far worse afterwards.
Absolutely.
And
Absolutely.
and I feel not only because it's like it's only one tiny part of the picture,
Hmm.
when it's delivered by a health system that's just wants results, you know,
Hmm.
they're not interested in the individual. They're not interested deeply in whether the graded exercise is going to work. They've got a theory and they want to make sure if it works in 5% of the time, then it works. You know,
Right.
the same with CBT. I mean, not all CBT practitioners are the same, cognitive behavioral therapy, but
Sure.
it's the only government approved therapy that you can have. And it's very, very functional and lacking and delivered by people that have got academic degrees without much personal experience. I make a broad assumption there, but that's what I get from the clients that have been through that kind of system historically.
Indeed. Indeed. Yeah. And graded exercise, even in the research, has been disproven, yet, you know, it takes a while for that information to get to the actual doctors who are prescribing this stuff.
Mm.
There's a large degree of doctors out here that don't even believe chronic fatigue syndrome is a thing, right? So it's tough to break through that. I don't know that we ever will. I had the same personal experience. Doctors would be like, "Of course you're tired. You're not exercising." I'm like, "I don't feel good when I exercise." But I tried it, and then I would crash, and then I'd go back, and they're like, "Well, you just did it wrong. You got to try it again." And I did it a couple times until I realized, okay, that guy might have a white coat on, but he doesn't know what he's talking about.
Love it.
So I
I
have to
love
be
it.
super cautious. I have to be cautious with exercise with patients, and I'm pro exercise in a big way. I want all my patients to move as much as possible, but not more. And when that physiologic threshold has decreased and we have this mitochondrial dysfunction, we can't handle the demand of exercise. I mean, exercise is it's a stress on the body. We know that exercise
Mm.
raises stress hormone levels purposefully,
Mm.
right? It's a good
Mm.
thing. Well, in a healthy system, yeah, you want to test that system, you strengthen it, right?
Mm.
Let's purposely put somebody into fight or flight a little bit. It causes adaptation. We get stronger. You can do this with cold exposure, which I'm sure you're familiar with.
Yeah.
It purposely stresses the system with the expectation that the parasympathetics will then get stronger in response. I
Mm.
can't do any of that stuff, at least early on with my patients, because
Mm.
their system's stuck anyway. We purposely stress them. Now they're stuck even more. Intermittent
Mm.
fasting is kind of the same conversation. When we
Mm.
don't eat, your body has to use stress hormone to maintain your blood sugar, and that's too much for people, at least in
Mm.
the beginning. Eventually, we can do those things,
Mm.
but not early on.
Yeah, yeah.
It's so poorly
Yeah.
understood, the whole
Yeah.
condition. Yeah.
But we are adding to the body of knowledge. I think, with every patient, with every client we see, we are
Oh yeah.
adding to that knowledge. The last thing I wanted to talk about, if you're okay to
I'm
finish.
okay. Yeah, this is
Yeah.
great. I'm enjoying the conversation. Thank
Okay, that's fantastic. We talked about, the characteristics of chronic fatigue, perfectionism, hypervigilance, and all that business.
you.
And I think, if I'm thinking about one or two of my recent clients who have been GPs, general practitioners, MDs in your
Hmm.
country,
Hmm.
and they're hugely disillusioned with the problem, of modern medicine, and understandably. But each of these women are Europeans, and they've been subject to the trauma of all the mass migration and the Second World War and all that business. And so have their families. Now, going back to Bruce Lipton and the epigenome and the epigenetic influence of events on the biology,
Hmm.
a lot of these clients or patients are carrying the trauma of past ancestors, and they're not even aware of it. They believe it's theirs. They carry it as a kind of a coat of shame or guilt. There's something wrong with me.
Indeed.
But in
Indeed.
fact, when you look back through the generations, they are just carrying the trauma of past generations. And um, I'm very fortunate to work with some people. This makes my heart sing when I'm working with people that have gone down the shamanic route, because they see the inheritance from ancestral programming going through and through and through. And one of my doctors, actually from Europe, she was very used to the shamanic traveling, and she went back. She said to me, "I want to get to the original wound."
Mm.
And I said, "Are you aware it may not be in this lifetime?" And she said, "Yes, yes." And I said, "Okay, well, let's see where we go." So I took her into hypnotherapy, into hypnosis, and I took her into a place of safety, resourcefulness, as you often do.
Hmm.
Then I asked her to look back down the family line, and she saw it going down her father's line, and
Hmm.
all of the trauma of going to war and all that business.
Hmm.
And it was traumatic for him, but he'd just passed that on to her in the way he treated her, and how he was treated by his father, and so on and so
Hmm.
forth. And it was a wound that she was carrying, but it wasn't hers. It
Hmm.
belonged to her family. And when she came out of the intervention, she looked at me and said, I can see it's not me. I can give it back. I can hand it back. I don't need to carry that anymore. And these moments are the moments of magic, if you like, these moments when
Yeah.
people realize, oh my goodness, I don't have to do that anymore. I don't have to carry that wound anymore. And I just wanted to
Wow.
share that with you because it's so Bruce Lipton and it's so epigenetic and
Very much so.
yeah.
Yeah. It's incredible. That's incredibly powerful. And this, pardon me, the this concept is somewhat new to me. My coach has been trying to nudge me in this direction because I'm very much a biochemistry physiologic guy. I know about the research of looking at women as they're pregnant. And if you look at the stress of that woman, you can predict the stress related disease that child will have in adulthood, shared circulation, this priming, this sensitization of the baby in utero. now the baby's born and it's already cranking out stress hormone. It's already sensitized. The baby's generally going to be irritable and colicky and not really sleep very well. And, if moms now have a new baby and their adrenals aren't up to par, they can take a bit of a dip and it can even be like a postpartum depression kind of thing. So I can make sense of that. And then I can make sense. Well, what if that is compounded, right, from generation to generation? I can see the physiological priming, but at an energetic level, right, these emotions are energy, and that energy will resonate over time, and being able to neutralize that energy in whatever way you can, whether it's through hypnosis, or one of my coaches just had me read a book called The Emotion Code, which was more of a muscle testing technique to be able to see where these hidden emotions are, and do basically a clearing, meridian clearing type of a thing, to be able to release these emotions that are holding people back. It's powerful. I mean, there's a lot of ways to get at that, generational trauma, so to speak, in amazing ways. So I think that work is brilliant. Yeah, I'm so pleased you get to do that with patients, and it takes a little while to be able to get to that. But it's very real. It's
Yeah,
very
I
real.
think it depends how they arrive. I'm fortunate in that people looking for me are looking for what I'm offering, and
Sure.
people looking for you are looking at what you're offering. So,
Indeed.
you know, so we do our work where we are most effective, don't
Yeah.
we? I mean,
Self-selected, right?
yeah,
Self-selected.
people
Yeah.
select themselves. I mean, if I were to be put into your shoes, I'd probably not have the first clue with all of these, supplements, or, and you've got some lovely ideas with your bucket of stress and your puzzle, therapeutic puzzle, like it sounds very what's the word, achievable, like I can put things into little boxes. It makes sense. I got a picture now. Whereas, a lot of my clients have actually they've done some of the picture, but there's something missing.
Hmm.
There's
Hmm.
something missing. Do you know what I mean? And
Indeed.
that's what they're
Indeed.
looking for.
It all fits, right? It all fits together, right? Your work, the work that I do,
Yeah.
it's tough because we know some of the basic central pieces of the puzzle because we all have this same stress
Yeah.
physiology, but even those pieces are going to be oriented a little different, right? Not the same relaxation exercise doesn't work for
Yes.
every person. Like, all right,
Yes.
so how do we make it work for you? And
Yeah.
that tends to be what I've gotten good at over time. My team and I is figuring out what that puzzle looks like, right? Because
Yeah.
I went to school to put those puzzles together. I learned under Dr. Posnecker, who'd been doing those puzzles for 30 years, and now I've been doing it for 24 years with thousands of patients. So you get better at it, right? And figuring out what those individual needs are.
Yeah.
And we want to work at all those various levels,
Yeah.
certainly, including the work that you do. I
Mm.
was reintroduced. You mentioned Bruce Lipton, if you have a moment.
Mm.
I
Yeah.
was reintroduced to his work probably about 2 years ago, which I love, right? His Biology of Belief that he wrote 20 years ago. And I was looking at some of his lectures. He's done the same lecture hundreds and hundreds of times, right? And because I'm a science guy, and he was a science guy, I like the explanation, taking it from a cellular level, right? And then having, receptors on the cells, right? And working me through some of the biochemistry and the physiology, getting to the point where, we can look at, okay, beliefs and perception modifying cells, right? Talking about the placebo effect, which still to this day blows my mind. The fact that you can tell somebody this is going to create physiologic change, and in 30% of the people, just because they believed it, it's going to work. And not in trivial situations, right? People with Parkinson's noticing less tremors. I mean, it's so incredibly powerful. I mean, what changed? The belief, right? The signals that ultimately got to the cells. It's really, really phenomenal. And I love Dr. Lipton's explanation of that subconscious programming, that theta brainwave state, which to my understanding is kind of where hypnosis kind of comes in, right? Tapping right into that subconscious programming and rewriting it, right? And
Mm.
rewriting it in whatever shape we can. So we try to do that work, or at least guide people to doing that work as much as possible. And I look forward to being able to uh, keep you busy and be able to
Yeah, well,
refer patients to you. As long as you're able to see patients, I still see patients one on one. I'm
yeah, me
in the
too.
midst of trying to write my book and create these other programs and training programs and all those kinds of things. And
And
uh,
that's where I'm heading as well, because there's only so many individuals you can work with until you
absolutely,
have to somehow clone yourself in some way or another, so that either your book, your programs, or your colleagues that you're training can deliver a
exactly,
similar kind of holding
yeah,
environment or, therapeutic tool.
100%.
Yeah. And,
Hmm.
when I first started with Raylan's video 2 years ago, I was just inundated. I'd gone from about 3 or 4 clients a week, just pottering around, growing a bit of food, and having a nice and easy lifestyle, to suddenly having, 30 clients a week, which is
Yeah,
like really
that's a
horrendous.
lot. That's a lot, and they all go into that bucket, right? So we've got to
Yeah.
protect ourselves, right?
Yeah,
Caregiver stress is very real, right? So
absolutely.
we've got to, I find that at whatever kind of functional capacity we're at, we just have to find the balance, right? And so for me to get there, I talk about the bucket. It's let's scoop whatever we can out of the bucket. Let's poke as many holes in the bucket as we can, because we're not meant to live a life without stress, right? We just don't want it to accumulate, right? So let's poke some holes, relaxation exercise, vagus nerve, whatever spiritual practice, whatever we can do. And then let's expand the bucket, right, to whatever your greatest capacity is. Then we can heal, right? So now that there's space, now we can heal. Our functional capacity can heal. And I find this all the time as my patients improve. I tell them one of the scariest things a patient can tell me is, doc, I'm feeling better. Because there's the test, right? Because now they're feeling better. Have they learned the lessons, right, that this condition has given them, or are they just going to fill up their bucket again and then go over the right?
Mm, mm, mm.
But it's a lovely, refreshing. It's a powerful process to go through. I'm blessed with where I've landed with patients and being able to give and educate and help and assist and coach
Mm,
it's such an amazing experience to be able to work directly one-on-one with people.
mm,
It's one of the passions that I have. I'd probably do a little less of it if I had my choice, so I could write and do all these other
mm.
things. But I enjoy it thoroughly.
Yeah, amazing.
Yeah,
Well, what a broad conversation we've had. We've covered so
indeed,
many areas,
indeed.
yeah.
I
So
really appreciate it.
no, it's been a pleasure, absolute pleasure. I love it. I wonder what's your website? How can people reach you?
drandrewneville.com. So drandrewneville.com. Same thing on YouTube. Search me on Facebook that way as well. So I do, trying to educate, trying to cut through all the noise that's out there. Obviously, with social media, it's one of these necessary evil tools that we have. But I do have a private Facebook group, which I really enjoy, that my team manages, and I'll pop on here and there. We've got kind of intro guides and information about, a lot of more in depth about a lot of what we've talked about, and how we see things and how we approach these things. Most of my patients find me through my YouTube channel because they can kind of get to know me, and by the time they're sitting in front of me, then they're talking about, I wish I had reached out sooner. I've been watching your stuff for a year, right? And trying to do some things, and I'm ready, right? I'm ready now. And they feel like they know me already by the time they get in front of me. So
Yeah.
it's really
This is
amazing.
a great tool, isn't it? It's YouTube for that
Oh,
reason. People can
100%.
get to feel you, they get to see and know your energy, and
Indeed.
which is why I reached out to you, because I thought I'm sure I'm going to have a great conversation with you. I feel that we're going to enjoy talking.
I'm glad you did.
Yeah, yeah.
I'm glad you
So,
did.
so for people wanting to know where I am, I'm literally just at openmindtherapy.co.uk. I haven't got many other socials except my YouTube, which is Jenny Lynn Open Mind. So that's as far as you can reach me. I'm running a retreat very soon. It's a training retreat at the end of May, and that's really for my colleagues. So we're going to take them into the deep sort of shamanic sort of,
Well,
how do we get to the core wounds? How do we get beyond? How do we heal ourselves first? Because, we can't heal anyone else before we're healed.
indeed.
And so a lot of the journeying is like, not only are we working on the client issues, but on our own issues. So that's why I'm calling it a retreat. It's
Mm.
immersive. It's,
That's amazing. That's amazing. I always, I've got patients all over the world, and I'm always learning geography. And there's a new town, and I forget the name of your town, but I saw you're kind of just east of London,
that's,
right on the
that's
water
right.
there.
Yes.
Beautiful place in the UK.
Yes.
I just spoke to a woman up in the Scottish, up in the Highlands, just the other week. We've got plenty of patients all over, which is lovely. It must be a beautiful area. I wish I could come for that retreat.
Well, you're welcome.
Thank you. Thank you.
Anyway, it's been a real pleasure. And
Indeed.
yeah, and I'll speak to you anon.
Fantastic. Fantastic. It really was a pleasure. I appreciate the conversation.
Brilliant.
Keep up
Brilliant.
the good work.